Welcome to Regent Park TV. I'm Victoria, and in this episode, we bring you a crucial press conference where frontline workers urgently call for the reversal of the province's decision to close supervised consumption sites.
We will ban drug consumption sites within 200 meters of schools and child care centers.
In a recent press conference at Queen's Park, frontline workers warned that the Ontario government's plan to close 10 supervised consumption sites will lead to more deaths from overdoses. The announcement has sparked significant concern, particularly among those working in downtown East Toronto communities, most impacted by the drug toxicity crisis. The closures will impact 5 Toronto sites, including those in downtown East areas like Regent Park, where they provide critical support to those struggling with addiction. Stay tuned as we explore the impact of these closures on our community.
Thank you so much. I'm Zoe Dodd. I'm a co-organizer with the Toronto Overdose Prevention Society. I'm also a worker. I'm a community scholar. I've worked in harm reduction, working with people who use drugs for over 20 years. I'm an expert in substance use and harm reduction, having done my master's degree in involuntary treatment and the programs people were forced into. 1 person dies every 2.5 hours from the toxic drug supply in Ontario. Since Ford took office, 21,000 people have died. We went from 2 people dying a day to 9. Evidence-based treatment exists in supervised consumption services. They are already hubs with wraparound services, and we cannot remove these lifelines. They should be expanded and funded with more resources. We are in a serious and deadly toxic drug death crisis with no coordinated tables or emergency task forces to address it, with political interference and hostility based on ideology, stigma, and discrimination. Archaic drug laws and enforcement have only contributed to the ever-rising toxic drug supply. The eras of Just Say No have made the toxic supply in North America out of control. Addressing this deadly emergency crisis needs a multi-pronged approach. This includes evidence-based supervised consumption sites, compassion clubs, safer supply, decriminalization, and evidence-based treatment that is gender-specific and inclusive, culturally appropriate, public, and where the profit motive is removed so people can get the care they need without pharma and profits interfering with good quality care. SCS and needle exchange programs are essential. They save lives and they decrease the risk of fatal overdose. Neighborhoods that put in SCS saw a more significant decrease in overdose deaths than those who don't. The crime stats that the ministry used were false claims. These were not cited, did not come from the Toronto police, and no correlation was made to the actual sites. Geographical proximity is not a connection. There are other factors causing increase in crime, like the cost of living and people struggling to survive in this province. This is not about the evidence of SCS. There is large amounts of research on supervised consumption sites, and the benefits of them has spanned decades. We cannot have moral ideology and discrimination be the backbone of public policies. A few vocal critics who will not be satisfied until they are closed, knowing full well people will die as a result, should not be setting policies in this province. The government is creating a false dichotomy between evidence-based treatment and evidence-based harm reduction. One of the comprehensive responses to the drug death crisis have been supervised consumption services. We need to expand them, we need to fund them, and we need to expand them to include inhalation. The majority of people dying from the toxic drug supply are dying at home alone, and they are inhaling their drugs. We need to scale up our interventions to save lives. People who use drugs, who use supervised consumption sites, are one population of people from all different socioeconomic backgrounds who shouldn't have to die. People who use drugs have value and deserve safety too. There is nothing more unsafe than the risk of death. At the same time as they move to shut SES, they're expanding alcohol in stores and gas stations at the cost of $225 million, associated with Ford's move to introduce alcohol in convenience stores early. More than enough to run 10 SES for 15 years. Approximate estimate at $1.5 million per year. For example, Sudbury ran at $1.5 million and Timmins at $1 million. Closing sites will also have anticipated pressure to EMS and emergency rooms and strain on services. We already have had emergency departments in this province close, and there are days that paramedics in Toronto cannot get out to all emergency calls. Waiting 25 minutes for an ambulance to arrive in a toxic drug poisoning overdose call would be too late. People are suffering from brain injuries at high rates from lack of oxygen, and their brains during overdose are affected because it's a respiratory emergency. We have been here. In 2018, when the Ford government took office, he quickly stated he wanted to close supervised consumption and overdose prevention sites. He canceled the Provincial Overdose Emergency Task Force, which was made up of experts working together from across the province, and he defunded 3 sites in Toronto, 2 of which his government say need to now close, despite operating without provincial funding. Deaths rose from 2 people dying a day to 9. He has not invested properly in drug treatment programs, a system that needs a complete overhaul and evaluation. That system fails people every day. Hospitals are not funded properly to address substance use, despite alcohol being one of its major contributors to hospital visits and deaths in this province. The 3 reviews were conducted about SES and the tragic incident that took the life of a South Riverdale resident in a gun-related and drug war violence incident. These reports were quietly released the day of the announcement to close sites. They were linked at the bottom of the Ministry of Health website. Nowhere in these reports do they recommend moving the sites, closing sites down, changing them to non-evidence-based abstinence models like the ones being proposed by Sylvia Jones. Last year alone, 3,812 people died in Ontario from the toxic drug supply. When we set up the first overdose prevention site in the province demanding a response to the mounting deaths, 867 people had died in 2016. In 2008, when we came here to Queen's Park, when we, the Toronto Overdose Prevention Society, put 1,287 crosses on the lawns of Queen's Park, we were letting them know that their cuts would kill, that many people had died in 2017. And if we were to come back here again and put crosses on the lawn of Queen's Park again, it would be almost 4,000 crosses. The sites have been saving lives. We have never fully dealt with the toxic drug supply or expanded services to address how people are using, like implementing inhalation in sites. And this government has failed Ontarians by not investing in the same system he wants people to voluntarily access when they can't even get into it. We all don't have $40,000 like his family. More detoxes does not solve a toxic drug death crisis. You cannot treat your way out of it. And more slogans does not save lives like bring our loved ones home. Many of us have already buried our loved ones, something I don't wish on anyone across the province, regardless of political party affiliations. Our loved ones have died. This government needs to walk back this deadly announcement and stop playing political football with people's lives. These cuts will kill. Thank you.
Good morning, everyone. My name is Naz Yadulahi. I'm president of QP Local 79, representing workers at the City of Toronto's supervised consumption sites, including Toronto Public Health's The Works and urgent public health needs sites like the one at Seton House. Today, I'm here to address a matter of life and death, literally. The Ford government's new policy on supervised consumption sites is being framed as a move to protect our children and ensure community safety. But let's be clear, this policy is not about safety. It's a calculated attempt to shut these critical sites down, which it is effectively doing. City of Toronto workers at these sites are devastated. They see firsthand the lives they save every day, the people they help, the harm they prevent. With this new policy, thousands of people in Toronto will die because of this decision. Drug users have always existed. They are people in our communities, they are our relatives, they are our friends, they are our neighbors, and they will continue to exist. The difference now is that without safe consumption sites, they will be forced into the shadows. This will lead to more needles on our streets, in our transit systems, in our parks, and yes, in the very same playgrounds that we're trying to save. Premier Ford thinks that replacing these sites with better treatment programs will somehow make things better. But let's remember, public health isn't just about treatment, it is about prevention. The science is clear. People are not going to stop using drugs simply because these sites are closed. What will happen is that they will use drugs in public spaces, putting themselves and others at greater risk. This policy will lead to an increase in ambulance calls, further strain on our public healthcare system, and longer wait times in an already overburdened emergency rooms. The ripple effects of this decision will be felt across the city, and the damage will be deep and long-lasting. To the Ford government, I say this: we see what you are doing. We will not be silent. To the people of Toronto, I urge you to stand with us, to stand with the workers who are on the front lines every day, and to stand with those whose lives are at risk because of this reckless and dangerous policy. Thank you.
Good morning. My name is Jessica Lyons. I'm a registered nurse and a CUPE member at the Moss Park CTS. I'm speaking today on behalf of CUPE Local 5399, who represents community health workers at both Moss Park and South Riverdale consumption and treatment sites, both of which will be ultimately shut down by the Ford government's new regressive policies. I want to start by giving some insight into the transformative work that happens at Moss Park CTS, where I work. In 2023, Moss Park workers reversed 517 potentially fatal overdoses, with recent monthly supervised visits of over 1,000. And we do so much more. The nursing team at Moss Park, for example, provided 116 unique individuals with primary care, including 532 instances of wound care. CTS workers connect people to this primary care. We provide vaccines, we perform testing and connection to treatment for HIV and hepatitis C. We refer and provide mental health supports. We run trauma-informed arts and writing programs. We feed people. We provide appointment reminders and accompaniments. We help people set up bank accounts. We celebrate every birthday. We help people tell their stories. We help families reconnect with their loved ones. We offer a space for people to be without judgment or shaming, to access the support and health care that everyone deserves. We are already doing the work that these supposed heart hubs are proposing, and we need more support and more funding to do our incredible work more expansively. That the Ford government, who, by the way, has never taken the time to visit one of our sites or to understand the vital health care work happening, has decided to shut it all down for political reasons is devastating news. This government, who is no friend to workers, to our hospitals, to our schools, makes decisions to please funders and developers, certainly not decisions that follow evidence-based health policy recommendations. Ford has been in office, as mentioned by my esteemed co-speakers, for the past 6 years without adequately addressing the public health crisis of overdose deaths. Ontario has the highest overdose death rate in the country at around 3,000 preventable deaths annually. Since there is no part of Ontario untouched by the toxic drug overdose crisis, it is our families and our communities that will be living the consequences of Ford and Minister Jones's recklessness. We're terrified because we know that with a shadow of a doubt, this will lead to many more preventable overdose deaths, deaths of people that we work with, who have families, who care for their friends, who read books, who love to bake, who are trying to get housing, who make art, and these people matter. Eliminating sites will increase public drug use, will increase public disposal of drug use equipment, will increase the incidences of bodies being discovered in alleyways, in parks, in Tim Hortons bathrooms, in libraries, and it will increase HIV and hepatitis C rates, and it fundamentally denies the right of a group of people their access to needed health services, period. We are calling on the government to stop these closures and to instead scale up a response that would actually address the crisis that we are in. which means expanding access to supervised injection services, expanding access to various evidence-based treatment types, and to address connected crises such as the affordable housing crisis in this province. And we are calling on workers in Ontario to join us in resistance, to be loud, to speak out, and to defend these vital health services. Thank you.
Good morning. My name is Lorraine Lamb, and I'm an outreach worker in the Downtown East. I also run a drop-in and currently also work with incarcerated youth under 30. I'll never forget the first person that I found unconscious, blue and slumped over, or the first person who died after my CPR attempts didn't work, or the first time I called a mom and that guttural wail on the other end of the phone when I said her son died from toxic drugs. After working in the Downtown East community for the last decade, these firsts have become hundreds. Hundreds of drug poisonings not reversed, hundreds of calls to families and sons and daughters and sisters lying in morgues, hundreds if not more preventable deaths. I signed up to be a harm reduction worker to support people, but instead I'm now trained as a funeral director and maybe even a first responder. When supervised consumption sites opened, we then saw thousands of lives saved, thousands of visits to these sites for wraparound care and support, and also thousands of dollars saved in our healthcare system because studies show repeatedly that these sites and safe supply programs result in less emergency visits and hospitalizations. There is this idea that only homeless people in Moss Park or Parkdale use drugs, but the reality is people are using drugs across class, gender, and race. Young people, construction workers, friends of mine who I went to university with, people who are housed. Toxic drugs affects everyone. I'm also here as a neighbor to a safe consumption site. And as a neighbor, I have seen the way that people in the community reach out to these sites for care. I have seen the way that people gather around these sites for support. I have seen the way that even my neighbors will call sites for assistance when they don't know how to deal with something in the community. As a neighbor and as a worker, I have witnessed the haven that these spaces are for people. People come here for food, for bathrooms, because has anyone tried to get into a public bathroom lately? To navigate IDs, to get housing applications done, bank accounts, as Jessica said. They come here when they get good news and bad news. They host birthday parties, memorials, healing circles. Staff here go support women who are having babies. And yes, they even come to these sites to apply for rehab. And yes, these sites have saved lives. Sites like these were sometimes people's homes outside the streets. Jesse is someone that all of us who are speaking knew. Jesse survived on the streets and he had goals to be a youth worker. And he did everything he could to get subsidized housing, including going to access the Moss Park Safe Consumption site for his supports and to do the work that he needed to do to pull all the pieces together. In November of 2020, after years and years of waiting for affordable housing, it was finally his turn. And me and several colleagues looked everywhere for him the day we got the news. The next morning on November 20th, I got a text that said that Jesse died in the alley down the street from the safe consumption site because he had nowhere to go to use that night. There was no staff around to reverse the effects of toxic drugs, and Jesse never got to sign that lease. And so counter to many public health experts and against several of their own reports, as what Zoe had started us off with, the Ford government is deciding to close sites. They are handing out death sentences, but disguising them as care for people who are using substances, disguising them as treatment facilities, and disguising them through an insulting number of supportive housing beds. 375 beds. In Toronto, there are 10,000 people sleeping in shelters. This is also a disgusting approach to trying to deal with homelessness. Ford has never invested in housing. The government says that closing the sites is about encouraging treatment in the form of rehab centers, but treatment is a spectrum, and truly what we need treatment from is treatment from state abandonment. Rehabs are often privatized, and the reality is that putting rehab versus safe consumption sites as a dichotomy is a false binary. We need both. Besides, when Minister Jones says that people just need to go to treatment, my question is, has she ever tried to get anyone into a rehab program? Because the wait list right now is months and months. And so what is one supposed to do in the meantime? Ford's cuts to safe consumption sites does not address what happens when toxic drugs are still reality. And we have piles of evidence that shows that abstinence-based programs have very low success rates and often require multiple tries and have many barriers. The Ford government says that these closures are about the safety of children or about schools, but if that's the case, they could just move the sites. But no, their recent announcement actually prevents new sites from opening. If we are concerned about public use, drug use, and needles on sidewalks, then what we actually need to do is scale up these services so that people have somewhere to go. My friend Pierre died in 2017 in a KFC bathroom. Is that what we want? I'll add that this is emotional labor that we're now putting onto people who are not qualified to do this work. We are now potentially putting the heavy emotional labor on KFC workers, coffee shop owners, TTC transit workers. Is that what we're really pushing for? In the same way that removing tents from parks does not erase homelessness, closing SES sites does not mean that drug use just stops. Substance use will still be here, and now people will have nowhere to go. And so, yes, people might end up using in your building's laneway or in the public parks and even on transit. Safe consumption site closures lead to preventable deaths in our communities. And is good public health policy not about keeping people alive? When a forest fire ravages through a community, we don't take away firefighters. When someone is drowning, we wouldn't tell the lifeguard to come off duty. And here we are, closing the same things that keep people alive. Closing these sites is a deflection of responsibility without addressing the decades of cuts to housing, mental health, and social services that affect everybody. The Ford government have had the last number of years to invest in actual solutions. Instead, they are playing with people's lives through politics. We cannot abandon people in these communities, and I strongly urge the Ford government to walk back their decision. And I strongly urge anybody who's listening to this, whether you are a worker or somebody living around the neighborhood, anybody who just cares about good public health and people, to strongly, strongly advocate for the opening of more safe consumption sites. Thank you.
Good morning. My name is Stephanie Myers, Vice President of OPSU Local 5115, the union representing workers at Regent Park Community Health Center. I am here as one of the many workers impacted by the closure announcement of supervised consumption sites, including the one in our community. I wonder if Doug Ford has seen an overdose, what it looks like. I wonder if he's seen a dead body that's overdosed, because I have, and many of the workers I work with have. I have worked in multiple supervised consumption sites in Toronto over the past 5 years, and I can attest to the life-saving care that these services provide. Not only do workers directly respond to and reverse overdoses, but we also connect service users to many different supports in our sector, including primary care and social work support. Supervised consumption sites provide a first point of care for many who need a place to manage their substance use safely with the support of empathetic and non-judgmental workers. The planned closures are a direct attack on both healthcare workers and our clients. We know that supervised consumption sites work in supporting people who use drugs, but Doug Ford and his government have chosen to shut down a life-saving service that goes against their own government's investigation and recommendation to fund and expand these sites. Public health care is being attacked at every angle by the Ford government and choosing to advance right-wing ideology and profit over evidence-based policy. Claims that these sites simply don't work are contrary to research and lived experience that says otherwise. The legitimacy of our work is constantly being questioned under this moral panic targeting people who use drugs, and the specialized care we provide and our expertise is rendered unimportant. Harm reduction workers showed up during the COVID-19 pandemic every day to care for our people. Can Ford say the same? Healthcare workers know that closures of supervised consumption sites will cause a ripple effect that will be felt in hospitals and emergency services. Ford promised to end hallway healthcare, and little has been done to address this. If supervised consumption sites are closed, overdoses and other chronic health conditions that are addressed in these sites will will cause longer wait times and more stress on an already burdened healthcare system unequipped to provide holistic and wraparound care. Doug Ford claims to support the workers. As a frontline healthcare worker, I can assure you that this can't be further from the truth. Supporting workers means listening to and consulting us. Ford did neither. Frontline workers reject the province's neglect of our communities and the people we work with. Supervised consumption site closures will lead to preventable deaths in our communities. The lives of people who use drugs matter. The provincial decision to close these services is a death sentence, as the unregulated drug supply becomes even more toxic. Supervised consumption sites save lives. We need to be scaling these services, not closing them. Thank you.
We're happy to take questions now.
Jack Howen with the Trillium. Hi Zoe. Zoe and I have talked about this, but I'm wondering if anyone else would like to chat about the process of getting someone into treatment right now, what that looks like and how difficult it is.
Just if you can go to the mic.
Oh, yeah.
Sorry.
Oh, I'm so sorry.
Sorry, take your time also.
Don't be sorry, we understand. Yes, thank you. Take your time.
Yeah, so the process of trying to get into rehab right now so the first step is usually around detoxing, and I don't know if anyone's tried to get a detox bed in the city lately. Nearly impossible. Mostly impossible. The last person that I supported trying to get into treatment, we had to fill out an application, so the person had to be in a decent headspace to fill out pages and pages of information, from very surface level particulars to, hey, what's your lots of deep history, and then it's the waiting game. It's we were told to call back every week or every couple weeks to see where they were on the waiting list, and to just keep calling and calling. And then after months, if your turn is finally up, they ask you, okay, you have to be a certain amount of time detox before you can come to treatment. And so then the process of trying to detox is also another barrier. The wait list for even the CAMH medical detox right now is also quite long. How long is it? 8 weeks. 8 weeks. There's also stipulations in different sites in terms of, okay, you can't smoke, and I don't know what people are supposed to do. Detoxing from drugs is one of the hardest things that people have to do, and there's no supports. You're taking people away. And so when you finally get to the point of being able to get to treatment after jumping all of these hoops, I'll be honest, I haven't worked with anybody that has actually been able to get into a rehab center their first try. Most people end up waiting years and years before they finally are able to get all the pieces together because of the barriers that are implemented.
What we're hearing is a conflation of what people's needs are and what we're doing as work. We're enabling people to live, not die.
We're also enabling people to come to a space where they feel seen, understood, appreciated, a place where people can make a contribution to a community. And I think that that's a huge piece that I would really appreciate it if Doug Ford came and could actually understand our work. Because the point is that when people feel that their lives matter, that they are valued, that they are seen and understood, that their successes and that their progress and whatever their goals are is celebrated, that somebody is taking the time to dress their feet, to order them a new pair of shoes, to walk with them to an appointment, that there's a transformation that occurs when people feel that their lives are valued, and goes a huge way to supporting people to a chaotic time of life that involves many factors, including trauma, including abuse, including unstable housing, to be able to find different ways to have more stability and to value themselves and to contribute to a community. And that's what we're fostering. That's how we count ourselves as providing a loving and caring community that's on the continuum of treatment. And we absolutely, I think where you're headed is you want to know how many phone calls and referrals we help and support people when they want to, without judgment, to access various evidence-based other kinds of treatments, such as addictions medicine, opioid agonist therapies, methadone clinics, these kinds of things. We have all of those resources. We have all of those phone numbers. We spend many minutes of every day on the phones with people, supporting them to make those connections. And also many minutes a day, we have phone numbers. Oh, your mom called. Here's the message. Let's call her back. Let's make sure she sees you in the newspaper, fighting for the services and the healthcare that you deserve. We're talking about a kind of care and a valuing of people that is about a lot of different aspects of life, and moving people into a place where they feel valued. Is that?
Yes, very much so. Another question, the government seems to be obviously very focused or preoccupied with the question of safety. Is there a way that you guys have thought about handling the safety issue without the need for over-policing? Or policing in general?
The sites are located in, there's no police at the sites already. And there are communities, there's like a community outreach team that works outside of the sites. There's security, there's like 3 types of security over by the works. I think also we need to talk about what is safety. Is safety a feeling, or is safety something that people have experienced? Do the people who use the services also not deserve safety? Some of those people are harassed outside those services. People are taking photos of them and video and putting them online. So when we talk about safety, we all have a responsibility to make it safe for everybody who lives in a community. And many of the people who are using those services have lived in those neighborhoods for generations. And their safety is not considered. And so, we think about safety all the time, because many of us are parents, or we also are neighbors. We live in those neighborhoods too. And so when we talk about safety, what exactly is it that we're talking about? In the recommendations in the reports, it didn't say anything about closing a site or moving a site. It just it recommended more communication. It recommended, better... better. There was a lot about communication, more funding, and more resources. We see the police budget growing all the time, but the police actually can't solve all of the issues in our society. They're not there to deal with public health responses, and they certainly, certainly don't need to increase them. If anything, we need to expand our funding, look at the designs of some of the sites, figure out how we can be more inclusive, and have constant conversations with neighbors. But there are very vocal critics who talk about safety but have no interest in ever working with the sites themselves to keep them going.
At least one of the reports, though, it did reference more security.
Yeah.
So is that something that you guys are talking about?
Yeah, and I think that's happening in the sites for sure. That already has increased in many of the sites. I also think that security could look like different things, including having more community involvement from the people who actually use the services. People do outreach into the community to make sure there's no needles in the parks. That's something really common. We could use funding for that. And then the community outreach teams, I think, are pretty good, because they build relationships with the people outside, the people that are the neighbors living in places beside it and within the sites. Would we want to see more security on a really huge level? I don't think it's necessary.
And who pays for the security, by the way? Is it the province, is the city? Where does the funding for the security come?
Services have to pay for them themselves. It's coming out of the service budgets. So it's impacting our ability to staff properly with more nurses, for example, let's say. I just wanted to mention also that there is a very extensive community engagement program at Moss Park today. There is an open house, and you are all welcome. It is at 3:30 at 134 Sherbourne. We conduct almost weekly, we call them lemonade stands, where we hand out lemonade, do naloxone training. We know all of the neighbors. In fact, they come and knock on the door when they see an overdose outdoors, and we've responded to hundreds of overdoses in the neighborhood outdoors and connect those people and bring them back to the site so that they know that we're there and that we're there for them. We have really good relationships with the neighbors around the site because they know that they're increasing the safety of the neighborhood.
I just wanted to go ahead.
Where do you go from here? Clearly you and the Ford government see this completely differently. I don't know, what's your next step?
I guess that's why we're here today, because we're trying to get the stories of the work and of the people that we work with out there, and we are not even remotely done. We are building with other locals, other unions. We are trying to gain more and more momentum and build a very broad unified resistance. And the goal is that we've seen Ford walk back on things, and he needs to walk this back. This is what he thought was a political power move, and it's a political liability. And it's also completely wrong-headed and disgusting, but it's also a political liability, and we need to show that.
I'm wondering for...
Sorry, just to add to that, I think what you'll see in the weeks to come is a mass mobilization of folks who feel strongly that these sites need to continue, and that shutting them down is a matter of life and death. So I think you could anticipate some of the things that you're seeing today, but more action around this stuff too.
For those of you working at sites that are slated to close, would you work at a heart hub?
Never.
Can you go to the mic and explain why not?
I would never work at a heart hub. I don't believe in the abstinence model as the only model in which we need to operate. I believe that people use drugs on a continuum and on a spectrum. I believe strongly in harm reduction, as I've seen it reduce HIV and Hep C. I've seen the benefits of it in people's lives. I've seen how people's lives have changed dramatically. This already is, the site's already, okay, look, 2018, Christine Elliott and Doug Ford wanted to close the sites. Then they had to walk it back, and they rebranded them as consumption and treatment services with the expectation that we would do that kind of work within them, which is what the Heart Hub is. Those will still be located next to childcare centers and schools. People who use drugs, who people don't want to be accessing these services or want them in their neighborhoods, will still be in your neighborhoods. And the work is already being done. Would I work at an abstinence-based model? Show me the evidence that it works to stop a toxic drug death crisis, and I would take it into consideration. At this point in time, there is no evidence to show that it would reduce mortality or reduce risk of death, and so no, I wouldn't. I wouldn't abandon people to die.
Just the simple premise that the heart hubs are forbidden to circulate clean supplies, from a public health perspective and just a straight up healthcare perspective, I mean, it's a clue that it makes zero sense, and that it's coming from an approach that is all about stigmatization.
Yeah, thank you for your question.
Don't forget to like, comment, share, and subscribe to our YouTube channel. And please follow our social media platforms. For more information, check out our website.